All right, hello with another 3 questions about the Pain Diaries. Question number 1, who are you?
My name is Pam Weatherbee. I'm a first-year psychiatry resident at the U of C.
Interesting. And so you're doing a rotation here at the Chronic Pain Center, right?
Yeah, it's a medical selective, so I get to choose to do 4 weeks in any area of medicine.
Interesting. Why did you choose chronic pain?
So I chose chronic pain because I felt like there was a lot of overlap between chronic pain syndromes and psychiatric diagnoses, especially axis 1 disorders like depression and anxiety. I also thought it would be interesting because I didn't really understand a lot about the narcotics they're used in chronic pain, and I felt like it would be very important for me to understand a little bit more on that side and how it kind of works with the addiction process as well, because a lot of people that are on chronic pain medications have addiction issues or perceived to have addiction issues.
Mm-hmm.
So I wanted to better understand that.
Oh, that's fascinating and good for you from a personal perspective. So one of the things when I was researching the play, I read a lot of statistics about how little pain is actually taught in medical schools, and that until you hit a residency, rarely do you even hear about it.
Right.
The only person that ever told me they were taught to ask about pain in a patient was one nurse that I interviewed out of 100 interviews. I'm curious, you're way fresher out of medical school than anybody I've talked to. Has that changed? Did you?
So I think we always touch on pain in medical school when we learn about the different systems in the body, and it's always something that's talked about, but we don't really do anything except for superficially cover it.
Mm-hmm.
I think pain is more of a complex medical issue that involves a lot of psychosocial issues and a lot of inherent traits of the person.
Mm-hmm.
So everything's different in every person, the way they deal with pain and how pain kind of manifests in different patients. So I think we don't get a ton of teaching, but I think it's difficult to teach pain in medical school because you really need to understand the person that the pain is coming from to better understand it as a process and to become more comfortable with it. So I think that getting opportunities like this is definitely something that every resident or medical student should have, so they have a better understanding of where pain comes from and how it comes out of different people and how you can kind of deal with it in more of a multidisciplinary setting.
Interesting. So mandatory pain rotations, yeah.
I think it wouldn't be a bad idea. I think it would be very hard to do logistically, but I think it's probably beneficial. I know it will definitely benefit myself in my teacher practice.
So what about movies? Do you enjoy movies?
I love movies.
Love movies.
Yeah.
And do you think there's an opportunity to actually learn from an entertaining movie?
I think 100%. I think that media has such an impact on people these days, especially video media. You know, it's easy to watch.
Mm-hmm.
People really find that that's an interactive process as opposed to reading something or having somebody talk to them. The video is something where you can kind of take in with all your senses what you're learning.
Yes.
And I think the things like TED Talks to me are really one of those ways I can become passionate about things because somebody else is presenting that to me on video. I think that's really, especially with the Generation X population, I think that's a way that I really learned. So I think it's really important to have that opportunity.
I'm with you. Me too, generation, because I love TED Talks. I couldn't believe people kept them secret from me for so long. That's awesome. Thank you so much for your time.